Good afternoon. Welcome to CCALAC's Patient Portal Enrollment Best Practices webinar for today, Monday, June 29th, 2015. My name is Raymond Dople, the Health Center Controlled Network Project Coordinator here at CCALAC. This webinar is an initiative of and supported by CCALAC's HCCN program. So a couple of reminders before we begin. This webinar is being recorded and will be made available for future viewing at the HCCN web portal at hccn.ccalac.org. Again, that is hccn.ccalac.org. We will be distributing a few handouts to include the slide deck after the webinar. However, if you are on the webinar, you should be able to download these handouts using the GoToMeeting console. Now, due to the large number of attendees for this webinar, all attendees will be in listen-only mode for the duration of the webinar. So please remember to mute your phone lines, and please do not place your phone line on hold. Otherwise, we may hear your hold music. There will be a Q&A session at the end of the webinar. Please submit all questions using the GoToWebinar chat feature using your GoToMeeting console. We're going to answer as many questions as we can. However, if we run out of time, we will send a follow-up communication after this webinar addressing any unanswered questions. Now, finally, an evaluation survey will appear on your screen at the end of the webinar. Please take a moment to fill it out. CCALAC values your feedback and input as it strives to bring you resources and trainings of value to you. So this webinar today will be conducted by Beverly Jenkins, the Director of Operations at Northeast Valley Health Corporation. Beverly joined Northeast Valley in 1998 as a clinic administrator and has served in her present position for the last 10 years. She has over 30 years of experience in managing personnel and systems in large multi-site environments. Beverly supervises the primary clinics and a call center that provides centralized access for appointments. She has led many quality improvement projects to include redesign, advanced access, health disparities, collaborative teams, and the Patient Portal Launch Project, which is the reason why we've asked her to do this webinar presentation today. Her vast experience has allowed her to make a difference in the communities that Northeast Valley serves. And so at this point, I will turn the webinar over to Beverly. So give us one moment while we transfer screens. All right, Beverly, I just made you the presenter, and so you may begin when you're ready.
Thank you, Raymond. I wanted to take a few moments to provide a few facts about Northeast Valley. We incorporated in 1971. We are an FQHC serving over 65,000 patients in the San Fernando and Santa Clarita Valleys, providing over 200,000 visits per year. We currently have 14 primary health centers, 4 dental centers, and 13 WIC program sites. We use the Next-Gen Practice Management, EHR, and the Patient Portal platform. We are Joint Commission accredited and certified as a patient-centered medical home. One of the 2014 challenges for our meaningful use was to achieve 50% of our patients would be provided tokens, and 5% would be enrolled in the portal and send a message during the last quarter of the year. We formed a task group that met weekly, and our pre-work included determining the number of patients that had emails. We developed a marketing campaign known as Get Connected. We purchased enrollment mobile computer carts using wireless infrastructure for the roaming teams. We developed patient brochure to introduce the patient portal. We had posters made that were displayed in the waiting areas. All staff wore Get Connected buttons. We purchased incentives to give to the participating patients. We held weekly random drawings for the enrolled patients, giving $50 gift cards for 14 weeks. None of this would have been possible without leadership buy-in and support. We determined the dollars we would gain. We requested 10%, approximately $50,000, as a commitment from the leadership to support the portal rollout project. We prepared a budget that included hiring a project coordinator, 5 FTEs of temporary staff. However, we quickly realized we needed additional resources. So we requested HR to assist in acquiring volunteers. We designed and purchased T-shirts for the temporary and volunteered staff that they would wear in the health centers. We decided the ideal workflow would be that the registration staff would issue tokens for every patient each day. The temporary and volunteer staff would assist patients with the enrollment process. We realized we didn't want registration doing it because we did not want to create a bottleneck. Each location had dedicated enrollment staff assigned. We also trained business office staff, clinical support staff, clinic administrators, RN supervisors, and departmental managers as additional resources to assist patients with the enrollment process. Indeed, this was an all-hands-on-deck approach. We became aware that patients lacked email addresses. Those that had computers, we assist them with setting up Gmail accounts. Patients also lacked computer literacy and internet access. Their lack of knowledge of the benefits of using a patient portal. Patients actually found no immediate value. There was a lack of patient-centered portal functionality and the challenge of maintaining timely responses to the patient's messages. The current features that we are able to provide are the ability for our patients to request appointments, their access to their care team members. They can also review and request medication refills, and they can request a copy of their chart. We have created crystal reports that enable us to review data weekly. We held weekly task force meetings. We reallocate resources as needed. We continue to measure our progress towards our goals. The lessons we've learned were, if patients feel there's no value, they will not utilize the portal. If your process is not part of a normal workflow, it will certainly fail. You need the ability to monitor timeliness of care teams' responses to patient messages. Our success: 73% of tokens were issued to patients corporate-wide, and all providers qualified. We enrolled and sent messages for 12% of our patients that were issued tokens corporate-wide, and 90% of all providers qualified. The monitoring process has been delegated to the clinic administrators. Volunteers continue to be an integral part of the enrollment process. We need to increase the functionality of the portal, and we're improving the reporting of the patient and the staff portal usage. This was and is the all-hands-on-deck approach Northeast Valley used. Thank you, Raymond.
Thank you, Beverly, for your presentation. So I want to mention to the attendees that we went, as part of our HCCN program, we went through all 27 HCCN health centers as part of the leadership engagement process. here for our program for the 3rd year. And we made it a point to ask in each of these meetings where everyone was at with respect to their patient portal. We found that a lot of our health centers, they're in we found them in varying stages of the process. Most of our health centers we found have implemented the portal, but were in with mixed success. There were a few folks that had not implemented the portal yet, but were just about to, or were planning to do so within a month after we met with them. And so when we went to the HCC and leadership engagement meeting at Northeast Valley, we were very impressed with the amount of success that they achieved as part of their patient portal rollout plan. And we wanted to share with you a little today, a part of that plan. What I also want to share with you, and give me a moment, Beverly, at this time, I'm going to take back presenter rights just for a moment. This is just, hold on one moment. What I want to share with the attendees, and you'll find this as one of the handouts that you would be able to download using the GoToMeeting console, is the patient portal enrollment utilization checklist. Actually, this isn't it. This is the other one right here. So we went over, in preparing the patient portal enrollment webinar today, we went over this checklist with Beverly and Stephen because we wanted to give attendees a takeaway item that they can take back and work with their patient portal implementation teams as they either begin or jumpstart their patient portal enrollment strategy process or enhance it. And so we developed this checklist as a handout for you all, and this was entirely based off of Beverly's presentation. We recommend that you take the following steps to enhance your patient portal enrollment rates and utilization process. This is not like a be-all and end-all checklist, but we took some ideas from Beverly's presentation and created a checklist that could help you. So the 5 steps that we came up with was: 1, secure health center leadership buy-in and support for extra resources, to include, as Beverly mentioned, determining the amount of MU payments gained in part by succeeding in meeting MU portal requirements, and budgeting a certain amount to support the patient portal rollout project. Secondly, you would form a patient portal steering committee and gather needed data and information. You would form a steering committee to include representatives from medical administration, health center operations, IT, patient outreach and patient advisor group, and each clinic site location. You would need to determine patient populations to be targeted for patient portal enrollment and the number of patients from targeted patient populations that currently have email addresses. You would develop and modify necessary workflows, ensuring that patients are offered access to the patient portal, but also that responses to any patient messages are given in a timely manner. And you would develop necessary patient portal reports and processes so that you monitor your success in working towards achieving your goals. Thirdly would be to enable patient portal features to increase its value to patients. What we've heard, and we've talked about this with Beverly as well, was you need to provide value to your patient portal so that patients would actually use it. If you just put your portal up with nothing much of value just so that you can meet a meaningful use requirement, you're not going to get much success. So you need to determine the features that will bring value to your patients and whether your health center should allow access to them, such as the ability for patients to message their care team, the ability for patients to review and request medication refills, the ability for patients to request a copy of their patient charts, and the ability to access, for patients to access their lab results. You need to make sure that you define how patient messages will be routed, meaning which care team members are going to be receiving your patient messages and responding, and who will be responding to them. You also need to determine the appropriate message response time. You need to make sure you test all features and ensure that patients can use them without any technical difficulty, and add any other features as appropriate or necessary depending on your current situation with your patients. Fourthly, you will need to acquire and develop patient portal enrollment materials and tools. So as Beverly mentioned, you will need to develop a patient portal marketing campaign. One of the things that could help you out with that is some of the patient portal outreach and engagement tools in the HCCN web portal. We released a number of those tools last year to our HCCN members, but anyone in the association that can access them. It includes templates for flyers, brochures, for you guys to distribute to your patients in the waiting room or put up as posters in the waiting room or the exam room. It also includes a slide deck that you could potentially put in the TV in your waiting room promoting the patient portal as a patient website, because as some of you may have figured out, the term patient portal does not necessarily have much meaning to the patients that you serve. And so we encourage you to use those tools. They are freely available to you, and you can freely edit and alter those templates as you see fit. We took a lot of those materials from the California Healthcare Foundation in their patient portal initiative. We also suggest that you purchase, if you need them, more patient portal engagement tools like mobile computer carts, kiosks, and tablets. In some of our CCALAC roundtables and work groups, we have discussed some of these things at length. So know that a lot of our clinics are considering such tools because they could really help with respect to patient portal enrollment. And fourthly, to develop and patient portal media to be handed out or shown to patients. You may want to ask your EHR vendor if they have some of these media, such as brochures, flyers, or videos, so that you don't necessarily have to recreate the wheel and create one yourselves. Now, we do know of some clinics that have had to do that because of the types of patient populations that they serve. But it will not hurt you to speak to your EHR vendor to see if they have any available media that can help you in this regard. And finally, managing the patient portal enrollment process to monitor its effectiveness. You need to make sure that you hold regular patient portal steering committee meetings, as Beverly mentioned. You would review patient portal enrollment reports regularly and reallocate resources as needed. It is important to be flexible in this regard. You will need to monitor timeliness of care teams' responses to patient messages, and also to hire any additional staff and recruit volunteers as needed to assist patients with the patient portal enrollment process. I know a lot of you have looked or are looking into this, and so know that many clinics have already looked and have found some success with respect to volunteers that can engage patients in the waiting room with their mobile computer cart, kiosk, or tablet, and just walk the patient through the process of the patient portal. Another handout, we distributed this handout earlier in the year but we also want to make sure that everyone is aware of it, is the strategies to increase patient utilization. We distributed this handout earlier this year just to make sure that folks are aware of some of the different tricks / strategies that people have used in the past or right now to encourage patient portal enrollment. So we split it out into 5 or so different categories here to include to improve patient access to the patient portal. You would deploy kiosks. If patients don't have internet access at home, you will recommend to connect them to their local library so they can access the internet. And improving patients' computer literacy so that they can better utilize the patient portal. In a category of actively facilitating patient portal enrollment, you would need to deploy outreach teams, existing staff, interns, and volunteers, as we stated earlier, but also leveraging the provider's influence on the patients. Ensuring that you have to ensure that you have their full support, because if the providers can mention anything about the patient portal during the visit, we feel that their influence can play a big role in terms of getting the patient and encouraging them to use the portal. With respect to incentivizing patient portal utilization and making it meaningful to patients, as Beverly mentioned, different incentives can be used. Maybe not only to the patients themselves, but also to the staff in terms of encouraging them to get patients to use portal. And also, as mentioned earlier, to enable the patient portal to post patients' lab results, as well as just other things that make the patient portal valuable to a patient to use. Fourthly, educating patients on the benefits of using the portal. Again, utilizing a video or a PowerPoint slide deck in the lobby area or the waiting room to educate patients on the benefits of the portal. Again, we have those tools available for you on the HCCN web portal. Utilizing posters, flyers, and/or brochures, again. And lastly, targeting patient populations more likely to use the portal. As mentioned earlier, you may want to do some research and determine what populations can you more easily than others get to use the portal so that they can push you towards your stated goals, such as HIV patients, diabetic patients, young or computer savvy patients, and so on and so forth. So I just wanted to take this time and spent a little time to just go over these 2 checklists with you. It actually wasn't planned, but I felt that the need to actually to go over these 2 with you, just to make sure that you're all aware of all the resources that are available to you, and that not only this, but also your peers and using our roundtables and work groups here at CCALAC to get the support that you need. And so what I want to do now, hopefully that also gave folks a bit of time to input any questions. So if you have any questions for Beverly, please put them in the question box. I'm going to give you folks 1 minute to input any questions, and then I will read some of those questions out. Okay, Beverly, are you ready to take some questions?
Yes, Raymond.
Okay, so the first question, please explain what is a token, and does that include the PIN number for registration?
That is the PIN number, yes.
Okay, very good. The second question is, please discuss design and logistics of the kiosks. To example, how large, where located, Are they all mobile? How secure are they from theft? So on and so forth.
We use the mobile carts, and we explored. Our IT department was very instrumental in getting us carts that looked like old-fashioned desks in the classroom on wheels. And they mounted the computers, and they were able to be rolled and used by the volunteers or the hired temporary staff, and then they were secured in the evening in the administrative offices at the locations. But they were never left unattended.
Okay. The next question is, how many staff versus volunteers did you bring on to get this done?
Well,
how many did you keep? Meaning, how will you sustain this over time?
The 5 temporary staff were only hired to get us through the end of the year. Actually, that 5 FTEs, we had about 20 that it represented. We got students, so their availability was varied. So our project coordinator had a panel that was put together to interview. Once they were hired, we got their schedule of availability. We knew we wanted to cover our clinics during the hours of operations. So those clinics that had extended hour, 12-hour shifts, we would be able to plug in the volunteers, or IE or staff, to cover those hours. As we were monitoring the progress, we would redeploy those areas that were doing better, or doing, as I should say, worse. We would put more hands on deck there. So that's why staff was shifting all of the time.
Okay. And where did you find the volunteers from? Any specific institution, school, organization?
Well, our HR department helped us with that. We have an individual that does volunteers all the time. I mean, we get requests from various programs. She has developed connections with a lot of our occupational centers, our Northridge, so they come from different levels. And in order to sustain this, that's why we continue with the volunteers. So all of our clinics have the volunteers, staff that they hire, or bring on board, I should say, for this project.
Okay. The next question is, what examples do you have for Portal Kiosk? I suppose the person that asked the question might have wanted to know, like, did you go with a specific vendor or a specific setup?
No, we wanted to go what we could afford, and our IT department explored what was out there and came up with these little carts that were mobile. They set the wireless infrastructure at our site so that we could have access, and that was the way we went. Certainly there's an investment of getting these computers, and we were timely because we were opening up a new site, and this project actually preceded the opening. So we were purchasing a number of computers, and we used those and through the end of the year until we had to move those over to be used at the new center that was opening. And then we had other computers that became available. So that's how we got the moving or mobile carts set up.
Okay, very good. The next question is, how often did you use the quote-unquote other additional resources to assist with enrollment?
That was sporadic. One of the things we realized also in looking at our workflow, adult patient appointments are longer. So we found that the opportunity, once a patient was roomed, then waiting for the provider, the MAs could help at that time with the enrollment process. So it was based on what was happening, what was the workflow in order for us to get the opportunity. And it was just everyone getting together, realizing, oh, I got an opportunity. Let me assist. Our medical director, as he worked some of the clinics, also got involved. So everybody just seized the opportunity, looked at the opportunity, and just started the enrollment.
All right. The next question is, how do you monitor if team members respond to the patient within the allotted response time? Is there a report you can run, or is it just manual monitoring?
No, our IT department, we've designed reports to run to see what is the response time. Once it's been received, how fast do we respond? So we have monitoring reports that IT department has designed for us.
I see. And just to clarify, Beverly, I know since you do use NextGen, that was a customized report that your IT folks built within the system.
Yeah, there's crystal reports that
Okay.
were developed. Absolutely.
Very good. The next question is, how were the computers locked to patient portal only use?
The IT department put the applications and developed how they could access. So I can't tell you specifically, but they're the ones that set the program up on the computers so that the staff and volunteers could use it for that purpose and not for other purposes.
All right. The next question is, how long did it take you to get to 50% plus 5% utilization? And the person that asked this question is referring to the meaningful use requirement thresholds.
Right. As we started October 1 of 2014, we started just monitoring and seeing some sites and providers, because we ran our reports by provider and location, because some of our providers go to multi-locations. So we had to track the activity based on where they worked. And it was very easy to determine where we were having success and where we needed to help. It took a while for the registration staff to get on board and realize every patient you register, you're issuing a token. Once that became a part of their everyday workflow, we quickly, that 50% was achieved very early. Then the next challenge was to get patients enrolled. And you had a mix. We had the staff there, but some patients said, oh no, I'll do it once I get home. And we all know that is not always going to happen. After we continue to track that, we realize we need to capture them while they're in the clinic. So we kind of changed our approach to make sure that at all costs that we could get these patients enrolled before they leave. And as you mentioned, Raymond, it is important to engage the providers in the process for them to be an advocate and talk to the patient about the advantage and what could benefit them. One of the things that we found that they initially used was requesting an appointment. And now we don't see that as much. And I attribute that to the fact that it's not a two-way. Once you request the appointment, then we have to send you an email back with what has been set, that may not meet the patient's need. So you have a back and forth conversation. So they find it a lot more user-friendly by calling the call center directly.
Okay, thank you so much. The last question I received just now, do you mind sharing your PNPs as well as your workflow? And again, like I believe this might be a little difficult because of the fact that not everyone in our association uses the same EHR, but what perhaps could be shared perhaps through our next-gen user group or some of our other roundtables or work groups, if anything, Beverly?
Well, yes, I think we would be very happy to do that. As you pointed out, if you don't have our system, practice management system, it would probably, you'd have to take a different approach or avenue, but certainly I can share what we did.
Thank you so much, Beverly. We do have another question that came up, Beverly. The question reads, she may have missed it, but do you have any leads working with you on this? And meaning, is there anyone responsible for the rollout process other than you?
Oh, yes, it was a team approach, absolutely. The committee, we had representation from medical administration. We had the IT department. We had our provider informatician who works with the next-gen training, and our director of quality improvement and public health also participated. And my boss, the COO, was also involved. So we had all levels of representatives. And again, we were able to hire a project coordinator. Now, she is no longer in that role, but she has been now moved to another department. But the monitoring of this process has now been delegated to the clinic administrators at each location. Now, our committee continues to meet, and we focus on other meaningful use as well as continuing to monitor this particular indicator. But the big push was to meet that first 90 days, which we've done, and we continue to move forward throughout the year. And as I said, those reports, they're ran by the administrators, they're working with their staff. Again, it's a part of their normal day of operation.
Very good. And I know patient portal rollout implementation, it takes, as Beverly said, it really takes a team. I think the person asking a question was following up, what about providers, MAs, front office?
Oh yeah, all on board.
Go ahead.
I've said they're all on board. It has to be a regular part of your workflow, which touches on each and every one that touches that patient during their patient experience or visit.
One other question I received, how did you get the providers to buy in?
Well, again, part of our campaign, we had to introduce everyone to the process. We introduced them to the workflow, so we attended the provider discipline meetings so they knew how it was going to work. The other thing we knew, we had no idea what the volume was going to be, and we also developed those response teams. And so this was very helpful so that the RN or LVN is looking and screening and oftentimes responding to the patients. Anything that needs to be passed off or tasked to a provider for additional input is done. But that helps with keeping their inbox not overwhelmed, and they like that aspect of it.
All right. seeing no other questions that come up. I'd like to thank Beverly so much for your wonderful presentation and answering all the questions that our attendees have about the patient portal enrollment process, because this has always been and will continue to be something that will be top of mind in a lot of health centers, not only in our HCCN, but in our association overall. So thank you so much, Beverly.
Thank you, Raymond.
Great. And so a couple of things before we conclude. All the handouts that we went over in today's webinar, as well as a copy of the slide deck, should already be available to you by through the GoToMeeting console. You can download it through the GoToMeeting console. However, we will be sending a follow-up email soon that will contain all those handouts, but we will get the link to the webinar recording soon on the HCCN web portal at hccn.ccalac.org. Again, that is hccn.ccalac.org. Again, please don't forget to fill out the evaluation survey after the end of this webinar. CCALAC values your feedback and input as it strives to bring you resources and trainings of value. So that concludes our webinar today. Thank you for attending our Patient Portal Enrollment Best Practices webinar. I hope you all have a great day. Thank you.